es saku, man mīļie, dārgie draugi, tas, kā viss šeit ir izvērties, es vispār neticēju un negaidīju. Lūk, ko nozīmē aprunāties ar savu paziņu par kādu tēmu, kas, manuprāt, ir visai kutelīga ļoti lielai daļai sabiedrības. Arī man arī ir savi stereotipi vienmēr bijuši par plastikas ķirurģiju. Un lūk, Marija ir saorganizējusi pilnīgi kā tādu interviju. Un kā jau mēs te aizkadrā runājām, man pat esot jāievēlās vēlēšanās, jo tiešām šī būs pirmā reize, kad es sarunāšos aci pret aci ar plastikas ķirurgu. Es esmu mazliet satraukusies, man tiešām šodien no rīta bija sajūta, ka man šodien ir operācija, ka man kaut ko kāds griezīs, bet viennozīmīgi tas tā nav, jo es esmu šeit, paldies Marijai, paldies Nordesthetics klinikai, ka viņa šādi visu varēja sāorganizēt un mūs šeit uzņēma. Un šodien es esmu šeit un es tiekos ar plastikas ķirurgu Andri, jeb lietuviešu valodā ir Andrius. Bet paliksim pie mums latviešu skaidri zināmā Andra, un viņš šodien atbildes sniegs uz visiem jūsu iesūtītajiem jautājumiem. Manuprāt, tā ir ekskluzīva iespēja. Un es ļoti ceru, ka šīs atbildes jums noderēs pieņemt tālāk jūsu lēmumus par labu vai par sliktu jūsu lēmumu doties pie ķirurga vai nedoties tomēr. Un, jā, es esmu uztraukusies, bet es domāju, ka mēs sākam. So, hello!
Hi!
Did you understand everything?
I have to admit I was wrong. Lithuanian and Latvian is more different than I thought.
So, yes.
I can see, I can understand few words that you are saying, but again, keeping a conversation with you in Latvian for me would be impossible at the moment.
The same I can tell about the Lithuanian. In the beginning, I was thinking the same. Oh, the languages are similar, but okay, that's why we're gonna talk today in English.
Yes.
So I want to say big thank you in the beginning that I'm here. I even didn't thought it's gonna happen like that. And I think it's really exclusive experience and chance to ask you all those questions from my followers and about those stereotypes about plastic surgeries, because I think the people mostly don't think it's something good, because usually they think it's only to make bigger breasts, bigger butt or lips or something like that, but it's not right. And I want you to start with that. Can you tell me more about you, about the place where we are, and yeah, because it's quite interesting.
Yeah, so thank you for coming. It's a pleasure having you here. It's always a pleasure that somebody comes to a different country and visit us, and we can chat about how we're doing here, but not only you see and learn, but I can learn from you and see what's happening in other countries, especially in Latvia, since we have patients coming from Latvia as well.
Oh, really?
Yeah, that's true. It's not very far away, so somehow I still have people coming from Riga to have operations done here, and they usually come back and they come for checkups. They just come for the consultation sometimes, not only for the surgery. Yeah, and if we talk about the stigmas and what people usually think about the plastic surgeons, that they are very, very posh people, very special, drive fancy cars, red Ferraris and so on, spend their free time in expensive yachts and so on. Unfortunately, I don't have a red Ferrari and I don't have my yacht, so
it's not your time still.
Maybe sometimes in the future, but I doubt.
Yeah.
Probably it's not going to happen. It's in the movies, and yes, people think that plastic surgery is only for the girls who wants to get the huge boobs or something to change their appearance in the way that it's very attracts attention, let's say, and so on. It's again a little bit untrue. Usually the people that come here, they want to get back what they lost, and usually that thing is the pregnancies, aging, or some traumas or deformities that they get during their life. So I say that most of the patients that we have here are mothers after they gave birth, and as we all know, that the pregnancy and giving birth, it's a huge change for the body. So usually they gain weight, they lose it, Breastfeeding is another topic that we can spend probably an hour or so talking about that, but it's another thing. It's all about, you know, expanding the skin, and sometimes it doesn't come back way it was before. So people are looking to get the comfort back that they used to have before, you know, events, let's call it that way.
But so the young ladies are not coming here?
Yes, we do have young ladies. Of course, we do have the young ladies. For example, our typical young lady would ask maybe for correction of the nose, or to get the breast implants if they have no breast. Sometimes they do a little bit of liposuction, but that's it.
Okay, but you didn't tell about yourself. How did you choose to do that? How did you choose to help people, help all those persons who need help, who need to make some kind of changes?
Yeah, so my story, you know, it's a long way to become a plastic surgeon. It's not that you can, you know, before a week you just come with the idea that suddenly you want to become one, and after 3 or 4 weeks you can get a license. Usually it's a long way. And during that long way, you do your medical studies. You then see many things that can be done with medicine. Then you decide whether you like it or not, whether you want to go to become a surgeon or maybe a neurologist, maybe something else. And then bit by bit, you start operating, assisting other doctors, and eventually, after 11 years of studies, you can end up where I am now and start your private practice. So that's how it goes.
So I understand you didn't want to become a singer at all.
No, I don't think that, you know, I really tried to sing, but, you know, the audience was a little bit, you know, surprised.
You know, as I'm telling always, it's just the 1% of talent and 99% is the hard
Definitely,
work.
I totally agree with you, but I'm not sure I have that much time left in my life so I can, you know, reach your level also. So.
But I'm sure you're in your right place.
I'm really, you know, belong here. I enjoy every day of my work, so I think I'm in the right place, yes.
I have a question about, you were telling that there are coming like people from Latvia.
Yeah.
And I was wondering, why do people choosing to go to make plastic surgeries not in their own countries, but they are going somewhere else, like about that myth about Turkey?
Yeah.
Why is that so?
I think that it's completely normal thing to go where you can find a better quality for lower price.
But I would be scared. Like I would like to be on my home place. Like if something.
Of course, it's scary. But you know, we have to understand that we are a very big clinic. We have like 9 surgeons working here under one roof, and we perform about 3,000 surgeries a year. So it's a big numbers. We are the biggest plastic surgery center in Baltic states, and you cannot find more experienced doctors and, you know, the quality that we offer anywhere else. So I think that's very normal to travel, you know, 100 or maybe 200 kilometers just to get a consultation, to get a surgery, and then come back. So at the moment we have patients going not only from Latvia, but we have patients going from the United Kingdom, Ireland, Sweden, Norway, and so on. Most of my patients are not the locals, they are coming from abroad. Did you have patients from other surgery clinics? Of course.
Yeah,
of course.
like he did it bad, or the clinic did bad. And
of course, you have, you know, many people that are complaining that something went wrong and so on, and the surgeon did something terrible and so on. And I don't think that it's completely true. It's just about the expectations and so on. And,
yes, exactly.
And I even, you know, with my patients, sometimes I say that you will never reach the goal that you are expecting, and
because it's impossible on your
it's
on
just
your body.
Impossible. Yeah, we cannot really, you know, make a big incision here and just put your head on the other body that you can choose from the catalog. You still have to work with your tissue, with your body, and so on. So there's always limitations. And I think the consultation and the, that we usually have in this office, in this environment, is very, very important, where I tell you what I can do, what you need, and what are realistic expectations and what you're gonna get after half a year. And then I can tell, yes, you are well informed, you're ready for the surgery, you will be satisfied, or sometimes I have to, tell that, sorry, I cannot perform the surgery because your expectations are too high. And you need to think about this and maybe go to another doctor, ask for another opinion, and so on. So it's sometimes you have to work as psychologist as well to just understand
but it's quite hard.
It's hard, but it's
to
part
try
of the work.
To
part of the work.
Tell the person it's impossible. It's impossible to have this body from that poster. The only thing we can do, like as you told, just to cut the head and put on this body.
But it's very important, and it's pretty often that the patients, they come and say, I need a facelift.
Yeah.
Please do a facelift.
Yeah.
And I always say, wait, let's start from the beginning. What is wrong with your face? What do you want to change? What are the problems? And not go for, directly for the procedure that is
because
that
I
can
just
fix
want
it. Yeah. So because if we talk about the faces and facial rejuvenation, the facelift is the most, aggressive thing to fix your face. But before that, there are many, many other things that you can do. You can put some fat in, you can do laser resurfacing, you can do, small things like eyelid surgery and so on. So sometimes people, they think that let's go for that, facelift and that will solve the
full
problems.
Package.
Yeah, but it's not true. So that's why we need a proper conversation before the surgery. So
I'm from Latvia, and I want to do something kind of surgery, like I don't know, example, nose.
Yeah.
So I'm Googling where to do plastic surgeon to my nose. What I need to do? Okay, I'm finding your clinic, Nordesthetics. So I need to call. I'm calling, and how it's happening.
Usually, to save the time, for the patient and for the surgeon as well. Usually, we start with the online thing. I ask them to send me photos, to tell me the expectations that they want, if we're talking about the nose, and then I can, sort of make a small simulation, what I can do with the surgery. And, usually it's again, the hump, the tip is being too wide, or, that is dropped down, the breathing problems that people ask, that they cannot really breathe from one side, or the septum is deviated and then the nose look in strange shape. And online I can tell that this and that can be done. I send the simulations before and after, just to inform what it may look like.
But it costs as well, right?
Usually the email is for free. It's I don't charge, for the emails. Then if they are interested and they see that, our opinion, we are on the same page, let's call it that way, they are very welcome to book the surgery straight away and come here. One day before we have a consultation, we are sitting in this room and discussing how it will be, what to expect and what is impossible to reach, and the next day we can do the surgery. Or you can come just for consultation and don't book for the surgery. Just come over, we'll spend half an hour or an hour talking about this, and then you decide whether you need surgery or no, and book it for a later time. That's how it goes.
Okay, and if you agree about the surgery, the patient stays here?
If you agree that you want to do the surgery and you already paid the small deposit, so you have a safe place.
So there's a deposit.
Oh yeah, of course. If you want to get a safe place here, safe surgery time, you need to pay a small amount of deposit here, and then you know that your place is booked. So the surgery is done the next day after our consultation, and then all the patients after general anesthesia, they stay one night in the clinic.
You have your own place to stay,
We have a surgical department where all the patients stay one night after the surgery. So the nurses, they would take care of you, see how you wake up and so on. For bigger surgeries, it's 2 nights. For small surgeries like no surgery is 1 night. But the general idea that after general anesthesia, you don't go home, you stay 1 night at the clinic. And later on, it's recommended to stay in Kaunas for a week or so.
If something...
Yeah, just to make sure that you are safe, you recover well, that it's actually safe for me. I want to sleep well, so I say that you should stay in the city.
With all your patients in your city, like
we want you to stay around. So if something happens, I can come and see you and help you as much as possible. So during that week, the patient is staying in our apartments that we can offer. Or you can choose a hotel in the city. And then depending on what procedure you had, you have to come and see me every 2 days or every, on the 5th day. Well, it depends. If you're operating the nose, the visit is needed only after 7 days, where I remove the cast and see how it looks, make sure that everything is correct, give you the rest of the recommendations, and you can fly home. If it's a facelift, for example, then you have to see me every 2 days and I examine you, make sure that everything goes right.
There's a question, breast augmentation, implants or fat?
Yeah, so we have 2 options to make your breast bigger. We can put an implant that is a foreign material.
What is inside there?
Silicone. Or in rare cases it can be filled with saline, just water, let's call it that way. Or another option, you can use your own fat to inject it.
Yeah.
That fat, stays, and you can get improvement in size. However, it's not that you can choose, because not all the girls can get fat from grafting to the breast. There are a few things. For example, if she's very athletic and there's no fat, no donor areas, you cannot just...
You can even have a donor for the fat?
Of course you can, donor areas, not that you can, that you can...
you can't get a donor for the fat?
No, not from other people,
okay.
no.
So you see?
Yeah, so the donor areas, I mean, if the girl is, is athletic and slim, there's no fat that we can harvest from. That's the problem. So then, no surgery. Mm-hmm. Yeah. Another thing is the shape of the breast. For certain shapes, fat grafting doesn't work. So that's why you need to see me, and I will tell you whether it's possible to do fat grafting or the implants. And we have to understand that the implant it holds certain shape. The implant is made different shapes, different sizes. Ones are very anatomical and creates very natural look. Others have a full upper poles to create fullness in the upper part. So the implant can reshape your breast and can give you a certain shape that we want.
But fat, no.
With the fat, we can just augment it. But already you have to start with a shape that is good and acceptable for the girl. All right. So I have very little of the patients that come with a perfect looking breast, let's say C-cup size, something like that, and they just want to augment it half a cup size or maybe a cup size. So the fat grafting would be available for those patients that have this beautiful looking breast and have the donor areas where I can harvest the fat. And unfortunately, not that many girls are like that. Usually the girls that I have here, they come after pregnancies. The breast is a little bit ptotic, so the nipple is below the intramammary fold, and then you need either implant and a lift procedure. Or sometimes implant is not needed, just a lift procedure. Okay,
so the main answer is you can't choose it by yourself. It depends on you.
It depends on the situation of how the breast look and the other circumstances that body fat in your body that can be harvested.
Okay.
So that's why you need a consultation with me, and then I can advise you what's the best option for you.
If you are putting a fat in the breast, is it possible to lose it if you are losing weight?
On the breast, yeah. That fat will, get its blood circulation, and it will stay forever. Of course, when we inject the fat, not all the fat survives. So let's say we inject 200 cc, just as an example. Usually about 100 cc will stay.
Yeah.
Okay, but that fat is forever.
You can't lose it.
No, you cannot lose it. If you gain weight, that fat will expand.
Yeah, if
you lose weight, it will shrink. It will act as your normal fat tissue. And probably you know that in your belly, if you gain weight, everything becomes big. If you lose it, everything shrinks down.
Okay. And what about the implants, side effects?
Yeah.
Because we have a lot of myths, like they can blow.
Yeah, well, people are telling strange stories where they've been flying and something just popped. And probably that's the implant. You know.
Sure.
Many things can pop in the plane, but probably that's the implant, you know. Some girls, you know, that's the implant. It's not true. I don't think that they can explode or do something like that. The implant is a very, very good material. It's strong silicone covering everything, and so it's not that easy to rip it.
What can happen? Maybe it's... I have heard that some who have implants, the time is going and it starts to like fall down, or your body can't take
it. So you are very right. Usually to all my patients, what I say that once you put the implant in, you're gonna need another surgery to replace it, to remove it, or do a small correction to the breast tissue. For example, do a lift procedure. So the implant is a foreign material, so with age, the implant can change, the silicone can become loose, and time to time we have implants that are...
After how many years approximately?
We say that it depends, but I say that if 10 years is a good amount of time for one pair of implants to work and satisfy the needs, let's say.
And if it's...
but the problems can come early, or some girls, they come even after 17 years.
17?
And everything is fine with that implant. But I say that, you know, general recommendation for the girls who get the surgery is for 10 years you have to just see your breast every morning and make sure that they don't change. If you see that they are nice and soft, no, deformations every morning, they're still the same, you can carry on for 10 years.
Okay.
After 10 years, you really need to do a checkups. You need to do an ultrasound yearly, just to make sure that everything is fine inside. There's no fluid around. The capsule that surrounds the implant is just right. There's no such thing as an implant rupture, and so.
So if you see the person and the wishes are crazy and like you say no, I'm not going to do this.
Yeah, but we have. That's
Thank
why.
you for that.
You're very welcome.
You're saving women's.
Yeah, but that's why we have the online consultations. We have the emails where the patient can upload the photos, and some of them, I just write by email that you are not ready for the surgery, or your expectations are too high. I cannot do this or that. So that's all the system works so that we can, bring the patients here and have the patients here sitting in my office who are motivated, who knows where they're going, and have the right expectations.
Tā, mīļie, tā, kad 2 deguns jūs uzlikt nevarēsiet, 4 krūtis jūs nevarēsiet ielikt, 2 augšā un 2 lejā, tā kā šeit droši var braukt un uzticēties, ka no jums spoku neuztaisīs, un jūs kaut kādas briesmīgās filmas arī neviens neīstenos. Nevajag sevi bojāt. And still about the implants, I had a question.
Yeah.
Does implant changes the taste of mother's milk?
I haven't tried it. I don't know, but I don't think so. I don't think so. I have.
It shouldn't change anything.
No, I've seen, and I had lots of patients who had the breast augmentation. Then they had children. They've been breastfeeding and so on. The idea we have to understand that for the girl to be able to breastfeed, we need a good connection between the nipple and the gland that produces the milk. Okay, so usually we do the surgery so that connection is not disturbed. Okay, usually the implant is put somewhere down deeper
Yeah.
and the gland is still connected to the nipple, and that function remains the same. You can breastfeed your babies. I'm pretty sure that they're gonna like the taste. Don't worry about that.
Mommy makeover. What is it, and how many patients have this surgery?
Yeah, so
What
this
does it
is
mean? I don't know. What
mommy
is that?
makeover. Yeah,
I'm not a mommy, so I don't know about.
that's
What is that?
Yeah, so mommy makeover is, as we call it, a group of surgeries to help girls recover, or let's say gain the body that they used to have after
Okay.
after giving birth to the babies.
Yeah.
Okay, so usually that involves breast
Breast.
and tummy, the
Yeah.
abdomen area. Of course, nowadays with the abdomen, we look at your torso as a one unit, and we can do all those surgeries together. So basically, the patient comes
So
to
it's called mommy makeover.
mom makeover. So usually the patient comes to improve the breast.
Yeah.
So then we discuss what is needed. Sometimes just a simple lift procedure of the breast is needed to reposition the nipple, make the breast round again, and so that's all that girl need. Sometimes the implant is needed, sometimes reduction is needed because the breasts are too big. So we make them smaller and put them where they should be, where they belong, okay? So that's the first part of the mommy makeover procedure.
Yeah.
The second part is the tummy. Well, usually what happens is two things. The muscles become separated because of the babies
Yeah.
being inside. They create quite big intra-abdominal pressure that separates the muscle, and you cannot really exercise them. You need a surgeon to stitch them together and put them where they belong. You can only exercise the muscle, but not the tissue around it. That's the thing. So
Putting it together.
yeah, to
back.
make the belly flat instead of being a little bit round, and then it's very usual that the girls come and say that everybody is congratulating me with another pregnancy.
But I'm not pregnant.
But, yeah, so it's not really nice. So what we do, we do the muscle repair, put those muscles together to create again flat abdominal wall, and we deal with the skin, because it's very often that the skin doesn't shrink down and we have an overhang. So that overhang has to be fixed. And to make everything nice, of course, liposuction is needed. Sometimes we need to do a little bit of incisions on the back to just, smooth everything and blend everything so that she gets a good looking shape.
How much time do patient need to recover?
Yeah, so after surgeries like that, they spend a little bit more time in the clinic. Instead of 1 day that we talked before, they spend 2 days here. Again, they need to spend a week here in the city so that I can, meet them afterwards, do a checkups and so. And then it's very important that they have to be 3 or 4 months without any heavy lifting and no physical activity, because we want those muscles to heal properly, and only then she can expect a good result.
So it's about 3 months.
I would say that
3-4 months.
yeah,
to
3-4
full
months,
recover.
but it depends what she's doing every
Yeah,
day.
yeah,
But
yeah.
if you are, you work in the office, let's say, and somebody can help you with your kids, it's fine to come back to your work even after 3 or 4 weeks. It's fine, but just the final result and final, let's say, come back to your normal lifestyle will be only after 3 months, and the final result after half a year.
About, I would like to reduce my nose. How much would it cost?
Yeah, so
But again, it depends.
it's two questions about
Yeah.
the price and about the nose reduction.
Yeah.
There's no such thing as nose reduction, because if we reduce it to very, very little nose, it may look pretty for some.
But from others, a bit stupid.
For others, a bit stupid. But another thing that is very important, your nose is not to make your face beautiful. Your nose is to breathe. That's the thing. And small noses, they don't breathe. And we have always respect the function of breathing
First, of course.
and then see how it looks. Another thing, that the beautiful nose will always breathe well. So that means that if we don't do something that is not according to the textbook, it should still be all right to breathe. and it will look very natural, very attractive, and very beautiful. That's the idea of it.
Yeah, and it's not
So-
going to be like that. Oh, I like this nose to how it looks to that actress, yeah, and I want to have the same. But maybe on your face, on your like how big is your face, proportions. It's not. It's
Yeah,
not
for
gonna
example,
look good.
yeah, for example, if you come to me and you say that your nose is too big and you want to make it smaller, I would say that no, I cannot help you. I don't think that you need that, and so on. Another thing is to change certain things about the
Yeah.
nose, not to reduce it, but for example, to lift the tip more up, to create a little bit of the slope instead of having a hump here. That can be changed and that can be adjusted.
And now I have a question for you. Do you look at people like when you see a new person, your like professionalism, and you look at it, and you need to do that, you need to leave that, and need to change it. There's a problem. I would do that. Is it like that?
Yeah, during the weekends I try to, try to not to think about work, but of course,
Yeah.
many things can happen, but I never tell it to
Of
others.
course.
If they don't
But just
want
in your mind, it's
yeah,
happening.
in your mind it happens, yes, but you never tell to others, but because it's a little bit,
Yeah.
they may not, you can actually, get them into trouble. They may start thinking that something is wrong with you, because if the specialist comes and tells that your ears are very protruded and they need to be fixed, a girl may find it, that it's a trouble, but it's not. So I always say that you should tell me what is the problem, and I can, give you an options how to fix it, and we can discuss and so on. But it's not like that she is coming, sitting down, and I tell you this is wrong, this is not right, and so on.
But you see the things.
Of course I see many things, but
Sometimes it could be a bit confused to the lady. She thinks that you flirt with her, but you are looking at her and like,
yeah, but
you need to do that.
But I would say that it's the same with the haircut.
Yes, I totally agree.
Yeah,
That's why I had this question like that. I can't.
You cannot really
listen.
tell me that something's wrong with my hair. Everything is right with it. I
And it's
do
the
not
same
feel.
with me. Like I can't listen normally when someone is singing.
Yeah,
I can't.
that's
do
a good
it.
example.
I'm checking the techniques, what is wrong, what you need to do better, and something like that. The way it should work, and this is not good. The falsetto is bad. The mixed voice, chest voice, it's not good. And I can't do anything. What are patients afraid of, mostly?
Very often they are very afraid of not waking up. They have this fear of something can happen during the surgery and so
What's
on.
gonna happen?
Yeah. Of course, they are always, you give your body to somebody that you met a day before or so. You are in a different country. They always have this kind of,
And it's a
fears.
surgery, of
and
course.
it's a surgery, and with the surgery complications and so on. They're always very, very afraid. And it's normal to be afraid. And sometimes I see that if the girl comes or the boy comes and they are not afraid, then something maybe is not right. They are not understanding where they're going. Of course, there's always...
Even that, yeah?
Yeah, it's always can be a trouble and problems, but that's why we are here. That's why we are big clinics, so we can deal with problems that come.
If patient is not satisfied with the result, who is responsible? Does the surgeon take full responsibility for the result?
We have to understand that as we talked, we cannot really remove your nose completely. Find the one on the catalog and put it on
I want
again.
this.
Yeah,
Let's buy it.
It doesn't work like that.
Yeah.
We can discuss. We can try to understand each other and go towards the goal, of having it. But it's never gonna be exactly what I promised. And that responsibility is for the patient. The result that is not satisfying is not, not satisfied by the patient. The patient is not satisfied by the result. The fault is not surgeon's fault. It's just about the expectations. And
But sometimes something can just go wrong.
Sometimes can go wrong, but it doesn't mean that the surgeon is the one to blame. For example, the scar, okay?
Yeah.
Every person scars differently.
Yeah.
And sometimes the scar is just a small line.
Sometimes it's big
and
ugly.
sometimes it's big and not beautiful. And sometimes we have hypertrophic scars that they grow bigger, and sometimes we have keloid scars. But all those incisions, all that suturing is done with the same hands by the same surgeon. You don't really do, once you do the stitching or do the surgery, you do one in the proper way and the other just, in other way. You always do your best.
Yeah.
And I don't think that it's a fault of the surgeon if something goes wrong.
But if something goes wrong,
I think it's responsibility for the surgeon to help that patient to solve the problems and to deal with the complications and to help as much as possible. And we all do that here. And then you're choosing your doctor, the clinic that where you want to get the surgery. Please go online, see what's written about the surgeon. Come for consultation. You don't need to go on the operating theaters just straight away.
Yeah.
Talk with him, see whether it's a good,
do the monitoring with a lot of information.
And it's very important whether the surgeon is available or not, and whether you trust or not. This is what makes you calm. And then the process is not that, nervous maybe, or.
Yeah, and if we are talking about, there is a question: how to choose your plastic surgeon? How you need to feel it? We have a good communication, or something like that. I like things that better.
I would always go online.
You will feel it, right?
See whether there are good reviews, bad reviews. Usually a surgeon who does quite a lot of surgery. And in a lot of surgery, many years in their practices, they will get many reviews. Some of them will be very good, some of them may not be very good, but that just shows that surgeon is practicing. It's not that you will not be his first client or his first patient. So do the research, see how it looks, come for consultation, have a talk, see whether it's good connection or not. And then a lot will, if you think that after doing those steps you are ready for the surgery, then go for it. If not, then stop and just think about it, because there's no rush.
Yeah,
it's
that's
not
really
like
sure.
a life-threatening diseases that we're dealing here. We're dealing with improving the quality of life. And
it's not a game, it's not a joke.
Yeah.
It's really serious.
Nu, lūk, atbildes esam ieguvuši. Godīgi es no sākuma te ha, un beigās es jūtu, ka es paliek aizvien nopietnāk un nopietnāk, jo tas tiešām, tas ir ļoti nopietni, tas nav joks, tā nav spēle. Un, manuprāt, es pati sev ieguļu ļoti daudz atziņas, and I want to say big thank you to you. You even changed my thoughts about plastic surgeons. Because there's that myth, it's only for those who drives Ferrari, bigger lips, bigger breasts, and so on. But no, it's really serious, and I really appreciate your job, what you are doing, and I really appreciate that you are one of those persons who can tell no, I'm not gonna do it, and you don't need that, and I really appreciate persons and professionals who are on their right place. So I can totally suggest my people from my country, you can come here and talk with Andrius, and he can explain everything you need and maybe what you don't need. So yes, thank you. But if I'm here, I want to say something, because Maria told me that we're gonna go to the operation hall.
Yeah, I can show you, more of the clinic. We can go to the operating theater where the magic happens.
It's
where
like
I spend
a theater.
Yeah, we call it operating theater. I don't know. It has nothing to do with the theater, with the drama.
Where I can sing or something like that.
You can try to sing if you want.
Yeah, we can try it. It would be quite interesting.
That's fine. But unfortunately today I have no patients, no clients. Usually these days,
Thanks God. Let's keep it for the next time.
But definitely we can go and see how it looks and where I spend most of the days. All right?
Okay, let's go.
Good.
If I must be honest, this room, it's not scary. The main idea sounds scary that I'm gonna go to. This is quite comfortable place. The atmosphere is good, so that's because you're doing good things here. You're not doing bad things.
No, no.
Yeah.
No. Let's talk about, you asked me about the instruments. I can show you if you want. And all my precious instruments. That's what I use in everyday situations.
What is this?
This is an electric knife. It's connected to the machine that is over there. And you can make incisions with that. You don't use scalpels anymore.
It's like with the with the laser?
Yeah. Well, it's not a laser. It's electricity current that cuts and stops the bleeding.
Yes.
That's to stop the bleeders. Yeah. If I see that the vessel is bleeding, you can stop that with the electrocautery. That's connected to the machine as well. And then again, very small and delicate instruments that I needed during the procedure. All the pin sets.
So you're taking something with
Yeah, you always use them for stitching and so. Please. And all the strange instruments to hold the tissue together. The needle holders. So that's a surgical needle where you stitch the wounds and so.
This is what I hate. I'm sorry, but this is what I hate needles.
This is what I love. This is what my everyday
It's even
life
hard
is.
for me to take analysis. I'm telling, I'm a grown-up woman, but I could start to scream, yell, I'm scared. Oh my God, and you love it.
Yeah, unfortunately that's what I do every day, and I would probably not.
Unfortunately.
Well, yeah, but it's fortunate for me. It's for some may look very strange, but there is a surgical hook. You know, then you create a pocket for the implant. You need to see what's happening inside, and so again,
so
very
you put
beautiful.
it inside and just
you create a pocket. You know, lift it. I can see whether it's
like
bleeding
to
or
broke
not.
the door if it's closed, yeah.
Not exactly. Not exactly. That's another one for the drain. Yeah, again, another hook to hold the tissue. It's pretty sharp.
What is this?
It's just
For what?
measurement, just to make sure that you don't make any mistakes.
No, I don't feel any more comfortable. No, this looks really like. Oh.
That's why I operate and you sing. I think that we have a clear answer.
I think that you are in your right place and I'm in my right place, and I wish you good luck with the good
Thank you very much.
persons, with good patients, to have them and get great results. I'm still gonna keep singing. And
Do that, please.
Yes,
please do
and
that.
I hope my time for plastic surgery is not gonna come really early, but if so, I'm gonna come to you.
Thank you very much. Thank
Because
you for your
now I
trust.
know with what you're gonna do the things for me.
Yeah, unfortunately, I don't show this to all the girls. The
Yeah.
rest of my patients has to trust on this.
Yeah. So I'm the lucky one.
Yeah, you are the lucky one.
Yay!